Bismillahirrahmanirrahim. Assalamu alaikum dear friends. Hope you will be fine with good health. Now coming to this video of pharmacology and therapeutics, I will discuss about anti-anginal drugs. This is part 1. I am Dr. Abdul Malik, PhD Pharmacology, College of Pharmacy, University of Sagoda. I will discuss about the angina and its type and its symptoms and cardiovascular diseases in general. And please subscribe my channel of Dr. Abdul Malik Official and watch this video up to the end. If you have any question, you can write in the comment section. So coming to the ischemic heart disease, atherosclerotic disease of coronary arteries, or we can call CAD, or ischemic heart disease, IHD, is the most common cause of mortality worldwide. Atherosclerotic lesions in coronary arteries can block blood flow, leading to an imbalance in myocardial oxygen supply and demand. This is the difference between the two. Oxygen supply is very important and oxygen demand is also very important. So both should be unbalanced. If there is an imbalance in these two, then there may happen atherosclerotic disease of coronary arteries or angina. That presents as stable angina or an acute coronary syndrome, or we can call myocardial infarction or unstable angina. This is nearby unstable angina is myocardial infarction, another type of myocardial infarction. Now coming to the difference between the oxygen supply and oxygen demand, this is very important. You can see from the normal metabolism requires oxygen supply. This is the normal. Both are equally. Oxygen demand is given to the tissues and oxygen supply is given to the tissues. So both are very important. So on another hand, if we see myocardial ischemia, insufficient oxygen supply is there is a difference, oxygen demand and oxygen supply, then there may happen myocardial, myo means muscles, cardial mean cardiac muscles, ischemia mean obstruction of the oxygen supply, or there is a hypoxia or less blood supply due to obstruction. So there may be spasm of the constrictions of the vascular smooth muscle, mean for example coronary arteries, that can happen, and spasm may happen, may lead to impede cardiac blood flow, and there may be less blood flow to the heart, and there is a reduction in perfusion and causing ischemia and angina pain. This can cause ischemia and angina pain. Typical angina pectoris is a characteristic sudden, severe, crushing chest pain that may radiate to the neck, jaw, back, and arms. So you can see the structure of the heart where all the arteries have been shown, coronary arteries. Basically, you can see there is aorta and circumflex artery, left coronary artery, anterior intraventricular artery, and right coronary arteries. So multiple arteries are there and veins are also there. So these are basically blocked, or there may happen spasm, and that can cause angina or cardiovascular problem or ischemia. So coming to the angina pectoris, what it means, its etymology, what is that? Angina means choking or suffocation, or there is a less supply of anything of the pectoris mean chest, pectus means chest. So there is a less supply of oxygen, less supply of blood to the tissues of the heart. So angina is caused by a drop in blood flow to the heart. This means heart muscle does not get enough oxygen to work well. Angina is a serious warning signal. It can happen before or after heart attack or by itself. Stress can cause angina because it makes heart work harder. So not all chest pains is a sign of heart diseases. So any other organ or tissue in chest can be source of chest pain, including heart, that can cause angina or pericarditis, lungs, pulmonary embolism, esophagus, gastroesophageal reflux, GERD disease, ribs, inflammation of the ribs and muscle of the tendons, strains, or nerves and shingles. Therefore, consult doctor for diagnosis of if this chest pain happen. So this is the normal artery If there is a fat, deposition of fat in the arteries, you can see there is a blocking of this opening, a lumen, and then accumulation of the plaque. There is a plaque, and there is a thrombosis formation. And there is a blockage of the coronary arteries, and the blood supply will be blocked to the tissues of the heart. This can cause angina or other diseases of the heart. So coming to the symptoms of the angina, what is this one? The main symptoms is chest pain. First is chest pain is the very important. This is the basically chest pain. Chest pain caused by angina usually feels tight, dull or heavy. It may spread to arms, neck, jaw or back. This can happen to the neck area and the pectoral girdle area and the arms, and it is triggered by physical exertion or stress. Basically, it exerts due to stress or physical activity or exercise, stops within a few minutes of resting. This is common symptoms of the angina. We will see next in the second part about the types of angina. Then we will discuss about the types of angina. So you can see the major symptoms of the angina include pain, shortness of breath, a difficulty in breathing, and tiredness or fatigue. So these are the major symptoms of angina pectoris. So thank you very much for your listening, for your attention. If you have any question, you can write in the comment section. I will discuss other parts of angina. You can see in the next video. You can watch on the next video. Thank you very much. Allah Hafiz.